we will give oxygen.
When we will give oxygen?
One time.
For breathing.
Hey, when you do initial assessment, you say Assalamu alaikum. He says I have chest pain. So ask him. I will take care of you. I will also provide you some oxygen. Hey, after
it will be with the B.
Hey, along with B.
After OPQRST?
No, before. It's better to. If you did not do it before, do it now. Okay. The better time is when you assess B. A, B, C. When you assess B in initial assessment, provide oxygen if necessary. Any patient. Assess this. No stethoscope, nothing now. In initial assessment, no equipments. Only your look.
Just looking for quality and.
Hey, like see, breathing is. This is one breathing. It's normally breathing. Another patient. So you see it actually whether the breathing is good or bad. So I finished OPQRST. Now what I will go to? Sample. So now, you said you have chest pain. So along with chest pain, do you have any other difficulties? No. So no other signs, no other symptoms, and I will look for any other signs, like use of accessory muscles, respiratory problems, all those chest rise, or any other signs. Then are you allergic to some medications or food or something else? Okay, he's allergic to fish. I did know that. Then, are you taking any medication? Have you taken any medication for this illness, or are you taking any medication for any problems in your life? So you have not taken anything now, and also you are not taking any other medications. Okay, that's a good information. Could you tell me just something about your past medical conditions? Have you ever had any illness, or have you undergone any surgery, hospitalized ever?
Yes.
No, so you are fit and fine, alhamdulillah. So, what did you had? Did you have your breakfast, or what is the last oral intake you had?
No.
So since morning you hadn't had anything? You haven't had anything? Okay. Could you please explain the events which led to this chest pain? Okay, so you're just sleeping and woke up, you have chest pain. Now, I will explain you again.
Last oral intake contained food.
Everything. Last oral intake, whatever he had. For example, that will become more significant in case of poisoning, in case of diabetes. For example, he says, I didn't have anything since from yesterday night. So nothing. So this could be hypoglycemia. So in diabetic patients, in poisoning patients, this is all very important history, last oral intake. Okay? Now, his history of onset, he said the pain started when he was sleeping. This is something very alarming. When you learn cardiology next semester, you will learn something about stable angina, stable chest pain, and unstable angina. When a patient is having chest pain without having any hard work, without having any type of physical exertion, is having chest pain means that's a very serious alarming condition. This is called unstable angina. One of the peculiarity of unstable angina is pain at rest. So keep in mind, that's why onset or events are very important to diagnose your patients, and also the treatment also differs from that.
Okay, question please. What about the treatments? Are you going to assess us about
No. Actually,
treatment?
during this exam today or tomorrow, we are not going to assess your treatment capability too much, except the basic treatments such as oxygen, reassurance, position of comfort, immediate transport, nitroglycerin, aspirin. These 5 things are expected from you.
The aspirin is for the dilation.
Aspirin is for preventing the further clotting inside the arteries.
Okay. Does it dilate the artery?
No. Nitroglycerin dilates the artery.
And
Aspirin prevents further clotting of the blood.
Okay.
No.
No.
Clotting of the vessel.
يمنع تجلط.
The main problem in this chest pain could be. The main problem for this chest pain patient could be a clot inside his arteries which is supplying to the heart. So this clot may be now 50% or 70%. If you don't give aspirin or some other drugs, heparin or clopidogrel, there are so many drugs which deals to that part.
Yeah.
Let's take very basic of aspirin. If you don't give aspirin, this 70 time by time, minutes by minute could increase to 71, 72, 80, 85, 90 kilo. It will increase to complete block.
Complete block.
So-
Ask him.
if you don't use aspirin. So aspirin could help you to prevent further, it will help you to prevent further clotting of the blood vessel. So nitroglycerin to dilate, aspirin to prevent further clotting. Whatever the clot happened, aspirin or nitroglycerin will do nothing with that. That has to be some other medication which we will learn next year. So don't concentrate too much on medications, concentrate too much on the steps.
So if the patient has chest pain, we will give him the two of them.
Yeah, nitroglycerin. But when you give nitroglycerin, mention about blood pressure. What is the blood pressure? Now my next step is I finished sample history.
Finish sample.
Okay.